Hi, I'm Meg Fisher. I'm a pediatric infectious disease subspecialist. I am the very new acting Deputy Commissioner of Health here at the Department of Health in New Jersey. And I am really delighted to moderate this back to school webinar. The webinar is entitled Keeping Kids Safe and Happy This School Year. And I'm delighted that I'm joined with two of my favorite colleagues who are both wonderful physicians. Dr. Denise Rogers is a family physician and vice chancellor for interprofessional programs at Rutgers. And Nutt Feingold is the division head of pediatric infectious diseases at Cooper. Now, today, what we're going to be discussing is the new COVID-19 updated bivalent booster. We'll also talk a little bit about monkeypox and polio. And we're happy to also talk about any questions that you all may have about getting your children back to school. We are experiencing a little difficulty with our taping, so but we have plenty of questions already here that we're ready to discuss. Before we start, though, I always start with this disclaimer whenever I talk about COVID-19 disease or the virus that causes it. Information is changing daily. Even 2 years into this pandemic, we are learning more and new things, and recommendations are changing very frequently. So what you hear today will be the information as we have it on September 8th, 2022 in the afternoon. That information may be out of date by the time we say it, by the end of the week, or certainly by the end of the month. So keep that in mind and really use the New Jersey Department of Health website for up-to-date information, the Centers for Disease Control and Prevention website for information that's updated daily, and for information about pediatrics and all things for children. You can also take a look at the American Academy of Pediatrics website, and they have a website specifically designed for parents that's called healthychildren.org. That's healthychildren.org. So I would highly recommend that to you. But let's start by talking about this new bivalent booster. So Dr. Rogers, tell us about how this is going to be used in adults.
Thank you, Dr. Fisher. And let me start by making a pitch for all of the parents listening to recognize that in this webinar that is focused on children, we're starting with adults because clearly one of the most important ways that we keep your children happy and healthy is for them to have healthy adults, parents, and guardians in their lives. And, I've heard very frequently that there is concern amongst many about the safety of these vaccines. And before I get into the new recommendations, I want to remind us all that as of now, over 12.5 billion doses of these vaccines have been given worldwide, and 14 million doses of these vaccines have been given in New Jersey. So the study has been done. We have found that these vaccines are incredibly safe and also incredibly effective in preventing people from being hospitalized and dying from COVID. Currently in the United States today, we have between 300 and 400 deaths from COVID every day. That's more people dying from COVID in the United States than die from stroke every day. And the majority of people who are dying are still disproportionately unvaccinated. So I encourage you, if you are on the fence about whether or not to get vaccinated as an adult, this is the time to do it. And clearly, you will be setting an important example for your children when you get your vaccine as well. So we're going to talk primarily about Moderna and Pfizer vaccines for adults. The J&J vaccine is still available, but in a much more limited capacity. And so primarily, we're using Moderna and Pfizer. For the Pfizer vaccine, it's essentially a 2-dose primary regimen where you get your first dose, and then 3 to 8 weeks after that, you get your second dose. And it's now recommended that that third dose be the new bivalent booster. For Moderna, you get your first dose 4 to 8 weeks after that first dose, you get your second dose. And then that third dose is the new bivalent configuration of the vaccine. So it's no longer recommended that you get a third dose of the Moderna and Pfizer. Now, many of you listening may have already gotten that third dose. And so the recommendation for you is that 8 weeks or more after having gotten that third dose, you get the new bivalent booster. And so it's recommended that everyone now get the bivalent booster at some point if you are an adult. And my colleague, Dr. Feingold, is going to talk now about the recommendations for children.
So for children, thank you, Dr. Rogers. For children, the recommendations for those, under 12 years old, up to the age of 12, has not really changed. So that, we really are, except that we have added a booster for the school-age children. But again, really from 6 months through 5 years, we can give the either Moderna or Pfizer vaccine. And the Moderna dosing is 2 separate doses, and the Pfizer is 3 separate doses in the pediatric population. We are seeing exactly the same safety profile that Dr. Rogers explained so well. There's been really very little concern about any kind of side effects. And the new bivalent vaccine is now replacing any booster dosing in children 12 years and over, which is great news. Some parents might wonder why we don't have the bivalent for the younger age group, and we just don't have the data yet, but the CDC and FDA are looking at this continuously, and I think as soon as there's enough data, that will be available for the younger children as well. In pediatrics, the numbers are still quite low in the youngest age groups. I have a fairly new granddaughter who sent me a picture of herself holding her vaccine card on her 6-month birthday, so to speak, when she got her first dose of the vaccine. We want to encourage parents. The best way to keep your child healthy this fall is to make sure that they are up to date with all their immunizations, including their influenza vaccines and their COVID vaccines. And the same experience that the adults are having as far as preventing severe illness, if not, and complications from severe illness are really have been outstanding with this vaccine.
Thanks. Dr. Rogers, can you explain for us, what does bivalent mean? What's the difference between bivalent and monovalent?
So essentially, bivalent means that they've taken 2 strains of the virus. So they've taken the original strain of the virus and used mRNA from that. And now they've taken mRNA from the BA4 and BA5 subvariants and combined those to make a bivalent vaccine. And it's interesting because we talk about bivalence in COVID as if it's a new thing, and it is for this vaccine, but we've had multivalent vaccines in influenza forever. As a matter of fact, this year's influenza vaccine is a quadrivalent vaccine. So this is an important step forward and not unusual thing that we do in order to better protect people from infectious diseases.
And I guess the benefit of this is not only will we get a boost for the original strain and some of those other ones, but we'll also get a big boost for the Omicron strain, that's the variant that's circulating right now.
That's exactly right.
Okay. So Dr. Feingold, if I have my child and they need the flu vaccine, can I get it right at the same time as the COVID vaccine?
Absolutely. There's no problem getting any number of vaccines at whatever's really due at that time with your COVID vaccine. And, the fall, as soon as flu vaccine is available, would be the perfect time to get up to date both with influenza vaccine and with the COVID vaccine before the weather gets cold. And, we expect to see more of both of those infections.
Thank you. Dr. Rogers, as a family physician, you're dealing with children and their adults as well. What do parents do if their children aren't up to date? How do they get them caught up?
Well, the good news for parents, and quite frankly, it's good news for us as physicians as well, is there are clear schedules that are put out by CDC that guide us in how to catch up children. And the most important thing I can say is that your children can get caught up. And so if your child missed one of those doses, it doesn't mean they have to start all over again. We can sort of catch them up. You should go to your provider. If you have a primary provider that you see for your child's health, they can help you get caught up. If not, many of the community clinics around the state can provide you with vaccinations. And then many local health departments actually also hold special vaccination events where you can also get your children caught up then.
And we know now in New Jersey that pharmacists can give vaccines to everyone 3 years of age and older. But I think, that's a great way to get caught up, but we also do want you to take your children to a healthcare provider, whether it's a pediatrician or a family physician or nurse practitioner. It's not only the vaccines that they need, but they also need the screening tests. They need, all the kind of guidance that we give them when they come to us for care. So a lot of children missed some of those appointments during the pandemic. And it's really very important to get them back to care.
So, Dr. Fisher, oh, I'm sorry, Dr. Feingold.
No, I was just going to add that for those, families that have been able to keep up with their primary care, many of these vaccines only require nurse visits. So they are, special sessions held often later in the day for working families, so that your child can come in and get their COVID and influenza vaccine and not necessarily need a visit at that point if they are otherwise doing okay.
Great point. Go ahead, Dr. Rogers.
So one of the things I wanted to also put out on the table is the elephant that is sometimes in the room regarding vaccine safety. And as an African-American physician, I often talk about the adverse impact of the Tuskegee study on what it has meant to African-American populations. What we don't talk enough about is the research misconduct of Andrew Wakefield and his colleagues, who published a study in Lancet in 1998 that said that MMR was associated with autism. This study has been completely debunked. There is no truth to it whatsoever, but it has led to a decades-long fear campaign based on lies that these vaccines are somehow causative for autism, and they are not. And I just want to make sure that we're able to put that out on the table and to say, quite frankly, in my own opinion, that Wakefield's misconduct was just as bad as what happened in Tuskegee in terms of what it has done to undermining public health in this country. These vaccines are critically important for children, and they are safe.
Thanks for that. I could not agree with you more. We had some questions about the vaccines that are required from school. And if a child is missing a vaccine or they're unvaccinated, what's the role of the school? And as I'm sure many of you know, New Jersey is a self-ruled state. So we have the ability for different schools to have to handle these policies a little bit differently. But we do have statewide requirements for school entry and requirements for what you should have when you're a sixth grader. So those requirements, the school nurses will check on those and will do everything to really try to work with you to ensure that your child can get all the vaccines they need to go to school. We really feel very strongly that we want all children in school. And sometimes a child may be behind, but they're starting the series, so they're in progress, and they will have the ability to go to school while they're getting the rest of those shots in to get it completed. So there is information on the New Jersey website to tell you exactly which vaccines are required for exactly which age. And it's as most things now have become, it's a little bit complicated. But the other thing I want you to remember is not all of the vaccines that would benefit your child are required for school attendance. So please talk to your pediatrician or your family physician or your nurse practitioner. See if there are other vaccines. Maybe they're not required for school, but they will protect your child from things like hepatitis A, things like human papillomavirus. So we really want to ensure that your children are as protected as they can be. And certainly vaccines are one of the major ways that we can do that. I want to shift now to polio, and I'm shifting to polio because we know that there was a case of paralytic polio in New York in June, and that of course makes us all kind of shudder and think back to the days when polio was rampant in the United States. 50,000 children a year were being infected. It turns out the good news about polio is there's lots of good news about polio. First of all, there's 3 strains of polio, and 2 of those strains have been eliminated from the entire world. However, we're not quite done with polio, and we know that many people who are infected with that virus don't get sick. So they can be shedding the virus and transmitting it to other people, and they don't even know that they have the virus. So that's the situation in New York, and because a single case of paralytic polio is considered an epidemic, the health department very quickly looked at the wastewater in New York City and found that in fact in several parts of New York City there is polio in the wastewater, and in fact in London and in Israel they have found polio in the wastewater, and they are the same strains. So we really want to be sure that all of your children are protected. The good news so far in New Jersey, we have tested our wastewater. We don't have widespread testing, but all of the testing that we have done has shown that we don't have polio in New Jersey at this time. But again, that could change. So we really want to stress that we want everybody to be up to date with their polio vaccine. So Dr. Rogers, if I'm an adult, do I need a polio booster?
If you are an adult and you're not in a line of work where you are at risk of caring for someone with polio, you do not need a booster. Your childhood immunization should be fine. However, if for some reason you're an adult and have never received a primary series of polio vaccines, then we urge you to get vaccinated. Because quite frankly, New York is a path ride away from New Jersey. And that's what I always keep in mind when we see certain infectious diseases cropping up in New York. Perfect.
And Dr. Feingold, are there any other places in the world where you need to get a polio booster?
Well, there are countries in the world, especially areas, where there's a lot of conflict, where there have been polio cases. But really, any traveler to a foreign country should be have received all their normal immunizations and be up to date before travel. There are some special vaccines that you need to consider if you're traveling to certain countries. But since polio is routine part of childhood immunizations, every child would be protected, assuming they had received their normal vaccines in infancy.
Fantastic. So we do have a comment from a parent about the bivalent vaccine, and what they're saying is please put some pressure on the appropriate people to get that Omicron booster for children under 5. So I am delighted to hear that. And certainly the companies are, as we speak, working on getting boosters for the younger ages. Remember that you do have to wait 2 months after those first doses. So if your child got the Moderna, if your child's under 5 and got the Moderna vaccine, they would get 2 doses, 3 to 8 weeks apart. Then they would have to wait 2 months for a booster. And if your child got the Pfizer vaccine, they had an initial series of 3 doses. So it may be, we do have a little time here for most children, but I'm very glad that people are interested in this, and that's what we want to see. We want to see more and more children, vaccinated and protected.
Dr. Fisher, can I just mention one thing about the Omicron vaccine? Just a question that had come up. Even if your child had COVID, which we know many, many children did, especially during the Omicron waves, nonetheless, vaccine is indicated, and it has been shown to actually boost their immunity very well, even following natural infection. So a history of Omicron infection or COVID infection is not a contraindication to COVID vaccine. I think just yesterday it was recommended that one could wait about 3 months following natural infection before getting boosted. But having been infected should not be any reason not to consider getting fully vaccinated.
Absolutely correct. And that you can wait 3 months, but you can also get it sooner if your circumstance is that you're immunocompromised or you have a lot of COVID in your area. It's okay to get it sooner, but it does now appear that if you wait a little bit longer, you may actually get a better response.
And I just want to reiterate, the same is the case for adults. So if you're an adult and you've had a COVID, you should still get the booster as well.
Excellent. Now, one question, if for adults, how do they know if they got the polio as a child, if they got the vaccine?
Well, the vast majority of children who went to public schools in this country will have gotten the polio vaccine. However, it can be a challenge, particularly so in New Jersey. We have a vaccine registry, and so it's possible that you could go to the state and see if that system could be queried to see if you've gotten it. If you're from another state, I'm crossing my fingers that that state will have had those records as well. But it can be challenging actually getting childhood immunization rates, particularly, if you're in my age category and your mother put that immunization card away somewhere that is buried forever and ever, it can be a challenge. So if you have other recommendations, Dr. Fisher, I'd be very interested in knowing what else can be done.
I don't. And I think what this does is tell us the value of having an immunization information system. The way our information system works in New Jersey, it's required for young children. So physicians who are immunizing children under age 7 put that information into the registry. But people my age or people who got their vaccine in other states, that information will not be in there. Good news for those of you who might have the application docket, that application on your phone, you can now go to docket and ask for not only your COVID information, COVID vaccine information, but it will also give you any information they have about any vaccines that you've gotten. This works best for children because unfortunately the information on adults is not in the registry because the registry wasn't keeping information on adults, and the pharmacists were not required to put the information into the registry. But it certainly speaks highly of how important and helpful a registry can be. Let's shift to monkeypox. So, Dr. Feingold, what do you think? What's the threat of getting monkeypox in schools?
I believe the threat is extremely low. So, although monkeypox certainly can infect anyone, there really has been the epidemic right now has been really contained for the most part in certain groups. So men who have sex with men have had the vast majority of cases, but clearly there has been some household transmission. I think it really requires very close contact with a case, and the chance of that occurring in the school setting, I think, is extremely, extremely low. And I would not consider it a real concern.
Excellent. So just as Dr. Feingold said, monkeypox is spread by close contact, contact with the rash, or close face-to-face contact, but very close contact. One good piece of news about monkeypox, it does appear that globally, the number of new cases is dropping off. It's not super fast drop off, but it's at least slowing down. And the same is true in the United States. And definitely the same thing is true in New Jersey. So we do keep track of the cases every day. And whereas we were seeing 20 to 40 new cases a day, we're now down to 1 to 5. So that's good news. We think that that's a combination of use of the vaccine in people who've been exposed or people who think they may have been exposed, and also change in some of the behaviors. So that's, I think, is good news about monkeypox, and I think parents should be pretty assured that this is not going to be an issue when they go to school. But it is possible. There have been about 5 cases now in children, and we know that we do have the ability, if a child is a household contact, they can get the vaccine under an emergency use authorization. The public health departments are the ones that take care of that program. As far as pre-exposure prophylaxis, we probably won't see that in children at this time, but if and when things change, then we will also change the recommendations for the use of the monkeypox vaccine.
And there is also treatment available. So not that we expect children to get this, but should that happen in a household setting, that there is actually specific treatment that's available even in very young pediatric patients.
Thanks. Absolutely.
Dr. Fisher,
yes.
One other thing I just wanted to reiterate about monkeypox is because the population that's been most affected are men who have sex with men, there is a misperception that this is a sexually transmitted disease. It is a disease that is transmitted by close contact. And part of the reason I think it's so important, particularly on a webinar like this one, to make that distinction, is that if a child gets monkeypox, it does not in any way imply that anything inappropriate sexually has happened with that child. It means that child may have just been held very closely by an adult who had the lesions. And so I'd like to make sure that everyone out there understand that distinction, because there's been some misinformation out sort of in the internet related to that. That's just not that useful.
Thanks for making that point. And the rash can be on your hands, it can be on your chest, it can be on your face. So it's very, yes, it can be transmitted during sexual relationships, but it also can be transmitted just by contact with the rash. So
and
excellent point.
Even contact with bed linens. So yes. That, there is fomite transmission. So that it's luckily, the cases are going down, and I think it's much less of a concern, but I think your point is very well taken, Dr. Rogers.
Okay, we're going to shift back now to COVID. And one of the questions is, I heard that the federal government will no longer be providing free COVID tests. So the first question is this true? And unfortunately, the answer to that is yes. And if so, how can you afford to test yourself? And the good news here is there are a variety of places where you can get the COVID vaccine. Many of the local health departments have the vaccine. It's been distributed to libraries and a number of different areas within your communities. So there is still free vaccine available. Go ahead, Dr. Feingold.
You're saying vaccine, but I think you mean tests.
Oh, yes. Oh, absolutely. I meant tests. Thank you for catching that. Boy, that would be a really bad message. So what we're talking about is COVID tests. COVID vaccines are still absolutely free from the government, and the bivalent boosters are free from the government. So now we're talking just about COVID tests. Thanks for picking that up and correcting me quickly.
The other thing is that many insurance companies, and even I think Medicaid and Medicare will provide free home testing. So there's an allotment for each family so that you could really get quite a number of free tests if you feel like that's going to alter your behavior. And some of the pharmacies are also offering free home tests. So even though they aren't shipping, the government isn't shipping it for free anymore. It's available. And lots of free testing at healthcare sites is clearly available.
Perfect. Thank you. Here's a more general question. What practices can my child practice to stay healthy and avoid getting sick from COVID, the flu, or even the common cold? So Dr. Feingold, what do you advise to keep those children healthy and safe?
Well, I think there are three things, probably big things. If your child is sick, keep them home. I know it's hard, you have to work, but if people are sick in the home and the child is sick, don't send them to school. Give them a couple days to recover. Hand washing is probably, after vaccine, one of the major ways we have to prevent transmission. So teaching your children how to wash their hands, use alcohol gel, for age appropriate children. That's really, really important. So we really want to institute that, making it fun for kids. I think the other thing we should remember is that, of course, vaccinating is number one. And so, getting the appropriate vaccines for COVID, influenza in particular, is a way. But I think we also need to leave room for children to wear masks, even if it isn't what everybody is doing. And we need to make that a very safe environment for children or families that choose to mask. And some preschools, I think, are still requiring masks. And, above the age of 2, most children are able to learn how to do that and have been doing it for a long time. And if the family or the child feels safer that way, especially in very large groups, we need to have individual choice and really encourage that behavior if that's what somebody chooses to do. So, and have masks available for those children. I think those are really what I would consider the main ways to keep your child healthy. I just want to say one last thing, and I know it's not strictly infectious disease, but something we all should be aware of. This COVID has taken an enormous mental health toll on children. Many children are, they may be going into 3rd grade, but they really missed a lot of first and possibly some of second. So, we really need to support our children from an emotional point of view, and getting back to school is one of the most important things we can do. But we also need to realize that some children are not where we might have thought they would be, and they may need a little extra help dealing with crowds, dealing with classroom academics, everything. So, we have to have a very gentle hand as we don't want to make them afraid, but we also want to support them to get back out into the world.
Absolutely. And there was just something published about over 10 million children have lost a parent or a caregiver. And those children, clearly, that is an adverse childhood event, and they need a resilient adult and someone to help them through. And that's one thing that all of our teachers can be for them. And school nurses, I found, are also wonderful at being resilient adults that can help our children get through some tough times at school. Going back to the infectious disease part, the one other thing I would mention is the so-called respiratory hygiene. So, when a child coughs or someone coughs, if they don't have a mask on, the last thing you want them to do is cover their mouth with their hand. So now in school, they're being taught, cough into your sleeve. And I always say, you cough into your sleeve, and then you can use the sleeve to take care of any secretions that you might need. If those secretions are in your shirt, on your sleeve, they're not going to be transmitted to other people. When they're on your hand, of course, they're going to go right to the next person or to the tabletop or to wherever else. So wash your hands, use that respiratory hygiene, and then remember, of course, get vaccinated. And, I think keeping children healthy and active is also important. So good nutrition and good activity levels. Any other thoughts, Dr. Rogers?
Yeah, I had a couple of thoughts. The first is going back actually to how you started this webinar, Dr. Fisher, about we don't know what we don't know yet about COVID. And so one of the things I encourage all of you to do as your children are allowed to go back to school without a mask is don't indicate to these children, oh, you're never going to have to wear a mask again, because that's the mistake we made early in the pandemic. Early in the pandemic, we said, oh, you're going to get vaccinated and life will go back to normal and don't worry about anything. And we, of course, in medicine knew that the possibility of variants was very high, and we were right. And there remains a possibility of new variants. And so I am in complete agreement, Dr. Feingold, that we want to allow those families that are comfortable with sending their children to school wearing a mask to have them do so. The Newark Public Schools actually are going to continue to require masks for the time being. And so if you're comfortable with your child not wearing a mask, that's also fine. But don't say to them, oh, you're never going to have to do it again, because it's very likely that we will have another round of variants, and we don't know if it'll be more serious or not. The other thing I'd like to do is to differentiate a little bit the two things that you both talked about and reinforce them. So on the one hand, we have a subset of children who have fallen behind significantly academically, who just didn't do well learning on a screen. And for those kids, I encourage parents to sort of seek out whatever kind of resources are available at their school. They may actually also need to look at some community-based tutoring kinds of services that may be available in community-based organizations. There's another subset of children who also have significant emotional difficulties. And there's a combination of the two. But I think we need to recognize that there may be a subset of kids who actually are doing fine academically, but suffering from anxiety and depression. You may have another group of children who have both. And so I just want parents to kind of think through what are the various types of support that I may need to get for my children. And as a family physician, I also want to acknowledge that many parents are also suffering from some of these same difficulties in terms of their own mental health, and we strongly encourage them to seek help if they need it as well.
Great point. Not just parents, but healthcare providers have also had a lot of stress and a lot of trouble adjusting. And we've seen this is across the board. It's just no one's had a great time during COVID. But you're absolutely right that many people have many children are very resilient and are doing very well. And I just want to harp on resiliency for a little bit, because we all know about the adverse childhood events, but we also need to remember about the good childhood events, and the having a stable adult in your life and having someone who cares about you. It can be a parent, but it can also be a non-parent. Just a trusted adult makes a huge difference in having children be more resilient. So all of us, Boys and Girls Clubs, all of the other things that connect children to trusted adults will help our kids as they go through this year. I want to ask about the flu vaccine. So is the flu vaccine different for children than it is for adults? So either one of you can take this.
Well, I can certainly make the point that the flu vaccine for adults over the age of 65 is different because it's a higher dose vaccine, because people over the age of 65 are somewhat more immunocompromised and need that higher dose of the vaccine. And I'll turn to Dr. Feingold to cover the rest of it. I took the easy part.
Thank you. The vaccine itself isn't, it's made as, I think Dr. Rogers mentioned, a quadrivalent vaccine. So it covers 4 different types of circulating influenza. And each year it's formulated specifically for what's predicted to circulate. So the dosing is different in pediatric patients, but the vaccine itself is not really different. It's the same vaccine with a very long safety record. The important thing is that that infants can start getting the flu vaccine at 6 months, but they need 2 doses before the start of a season. And if they're too young or they turn 6 months and they've only received 1 dose, they need to get 2 doses up till about the age of 8 to sort of have an adequate place to start when they receive vaccine. But otherwise, other than the dosing based on age, the vaccine itself is essentially the same.
And we have 2 different types of influenza vaccines. We have the inactivated products, and there are several different ones of those. There's a high dose for the adults. There's some that are made differently, so there's no egg product in them. But just about anyone can get any of the inactivated vaccines. And then we have the live attenuated vaccine, which is given as a spray in the nose. That is approved for adults, but only adults up to age 40. I think
it's 40. Yeah.
Yep. And children as young as 2. So there is that option. If and there's no preference this year. The American Academy of Pediatrics and the Centers for Disease Control have said whichever vaccine you want, there isn't a preference. I would say for people with white hair like I have, there is a preference that you get the high dose one because it works better.
Absolutely. Could I also just do one more reminder for people? Flu vaccines do not give you the flu. Let me repeat it. Flu vaccines do not give you the flu. And one of the things we actually learned from the COVID vaccine is that a subset of people, after they got the COVID vaccine, at 24, 48 hours max, was sort of feeling a little achy, feeling more tired. Some people had a headache. Well, that can happen after the flu vaccine as well. However, that does not mean you have the flu. So please don't let that concern stop you from getting your annual flu vaccinations.
Yeah,
and I guess
you might just mention about the flu vaccine is that the cell-free vaccine that has, doesn't get anywhere near an egg, which some parents have still been concerned about, was now approved for down to 6 months. So parents who feel very strongly about avoiding any of the, vaccines that were previously made in egg culture can now get cell-free vaccine for their youngest family members.
Great point. We do know though that the other vaccines for the vast majority of children, they are absolutely totally safe. And just as Dr. Rogers said at the beginning about COVID-19 vaccine being most important for preventing hospitalizations and deaths, likewise, the influenza vaccine is most important at preventing complications of influenza, hospitalization, and death. So neither the COVID vaccine nor influenza are going to prevent every single case of disease, but they will make you less likely to get hospitalized and to end up, in serious condition. So I think that we should remember that about most everything in life. Nothing is perfect, but whatever we can do to make things better, that's where we're going.
The other thing we might say about influenza vaccine is because there was a question submitted about what's the best time to get the flu vaccine. And pretty much the recommendation is once it's available and in doctor's offices or in the pharmacies, you can go ahead and start getting it. The protection will last throughout the flu season, at least what we generally consider flu season, with its peak between sort of December and the end of February. So, and they're really trying to wait and time it perfectly, is better to go ahead and just, the beginning of school, as soon as your doctor has or health center has it available, go ahead and get your children immunized and yourself.
And that should be right about now. So the vaccine should be available, and it is time to get it. We predict how our flu season is going to be based on what's happened in the Southern Hemisphere, because this is mainly a winter disease. And what we know from Australia, from the information in Australia, was this was a particularly severe influenza season in Australia, and it started a little bit early, and it was very tough on children. So if that's the omen for us, then it's really important to get your children immunized for influenza. And for adults, don't wait. Go ahead and get your vaccine right away.
Dr. Fisher, if I could also just put a plug in that you mentioned earlier, which is that pharmacies are quite able to give influenza vaccines. And I encourage, for some of you, make it a family affair. So that you guardians and parents go with your child and you get yours, and then they get theirs, and you become a model of that good preventive care that they will follow throughout their lives.
Well, that's perfect, because that brings me to one of our last questions, which is, what vaccines are important for adults?
Well, let me start by saying it's really important that adults have gotten their childhood vaccines, because that lays the foundation for a healthier adulthood. And it's interesting when we talk about adult vaccines. I'm going to talk about for a second the vaccine for shingles, but I'm going to say to the adults listening that if you vaccinate your children against chickenpox, which many people sort of think of, oh, that's just a convenience vaccine. Oh, we don't really need it. We need to recognize that it's actually having had chickenpox in childhood that leads you to be at risk for getting shingles in adulthood, which can be a very, very devastating, difficult illness for adults, older adults, middle-aged and older adults. And so if you are of an age over 50, you should get the shingles vaccine, but let this be a vaccine that we eventually want to have to stop production of, because all of the children will have gotten their cell vaccines and we won't need it. So that's my first plug. My second plug is I want to talk about young adults for a minute, because what we're increasingly recognizing is that young adults, perhaps even up to their mid-30s, should get HPV vaccine, because the evidence is just really, really clear that HPV is a significant cause of several important cancers, cervical cancer obviously being the one that is most frequently talked about, but it can contribute to oral and esophageal cancers, to rectal cancers. And so as young adults are becoming sexually active, we want to get them the HPV vaccine as well. Obviously, adults need to be immunized against pneumonia. They need the Pneumovax vaccines. And adults also need every 10 years to get the little d tap, the diphtheria, tetanus, and pertussis vaccines as well. So that will be ongoing. I probably missed one, but if I did, please, colleagues, remind me.
Well, there's the Tdap vaccine for each pregnancy.
Yes, of course.
And that would, because that protects both the mother and the baby from whooping cough, which can be a severe disease in young infants.
Absolutely.
And Dr.
And then hepatitis. I don't want to forget hepatitis B. And again, depending on your circumstance, if you're traveling, some adults may need to get hepatitis A as well.
Excellent, excellent. Dr. Feingold, a second about teenagers. What vaccines do they need?
Well, they need to make sure they're up to date with, their Tdaps as well. And HPV, again, is, very important in this age group. And then, of course, at age 11 and then 16 or before college, we're encouraging the meningococcal vaccine for both type A, well, the type B and the other groups of meningococcal, the vaccine that covers the other groups of meningococcal disease. So I think those are, but we often, I think teenagers, it's part of how they're supposed to be. They think they are, sort of, nothing can hurt them, and they're not vulnerable to significant illness. But we want to encourage that attitude in life, but make sure that they're completely protected against vaccine preventable diseases, including influenza and COVID. I mean, some of our sickest patients have been, the 16, 17, and 18-year-olds who with COVID. Yeah, absolutely. Just an interesting thing about the shingles vaccine, the ophthalmologists have been pushing that very strongly, since there can be such, significant consequences with shingles around the eye. So they're one of the groups that often, they're doing cataract surgery and reminding people they need to get their shingles vaccine.
Excellent. Well, I want to thank you both. We're at the top of the hour, and I just want to give each of you a chance to give us a parting message. And we'll start with you, Dr. Rogers.
So I think the most important parting message that I could give is a reminder that we have shown over time that, by and large, vaccines are incredibly safe and incredibly effective. And that before we had vaccines, the average life expectancy in this country was 45, 50, 60, maybe at most. And major causes of death were infectious diseases. And we forget that, because what COVID has reminded us of is the incredible toll that infectious diseases can take on human life and health. And we can prevent these adverse consequences for many, many diseases now if we all get vaccinated.
Thanks. And Dr. Feingold.
My major point would be that we know that parents want nothing but to protect their children and take the best possible care they can of their children. And if you still are hesitant about vaccines, about any vaccine, the ones we've spoken about today, COVID and influenza, talk to your healthcare provider. Be upfront. What are your fears? And let them try to address them and meet you, so that they can, really try to help to get you through your fears and protect your children, because we all want the same thing, the healthiest young people we can possibly have.
Fantastic. Well, again, thank you both. And thanks for watching this. And if you have other questions, please let us know, and we'll be happy to try to answer them. So have a great day, and I hope your children have a wonderful time in school this year. Take care, everyone. Bye-bye.
Thank you.